Assalamu alaikum. I am Ahmed Ramadan for Muslim Network TV. Today we have with us a very special guest, Dr. Herzallah, who is the co-founder of Doctors for Gaza. Dr. Herzallah, assalamu alaikum. Thank you so much for joining us.
Wa alaikum salam. Thank you for having us. It's our pleasure and honor to be here to speak about Gazans.
Well, it's a very critical time, and it's a really timely interview because we need your critical updates. I know you have doctors on the ground there that you're communicating with. But before we get into that, I wanted to first ask you about this initiative, why you started it, and what is the mission?
Yeah, thank you for asking that. Firstly, as you know, after the catastrophic situation happening in Gaza now, specifically the medical system, which is overwhelmed and exhausted, me and my colleagues, doctors from around the world, we were feeling useless and we are feeling stuck and trying to help in all the ways that we can. So we got this idea to create this initiative to support Gazans and to support the healthcare workers, our colleagues in Gaza. And we were aiming to do multiple things. Firstly, to do fundraisings and gather donation to build medical points. And we did multiple medical points on the ground, which was serving multiple people in Gaza. The second thing was to raise awareness in Arabic for people in Gaza, specifically about the medical conditions and the serious medical conditions. As you know, there is a lot of serious medical conditions, and a lot of people they couldn't reach out to the hospitals due to the severe shortage over there. So through this awareness, we are trying our best to raise some awareness of how to deal with those conditions. The third thing is to support people in Gaza regarding the mental health issues. Specifically, we are who are far away are having some exhaustion and serious mental health condition after watching just the news. So what about the people who are in Gaza? So those are our main aims to support people. As well, we are having some team who is treating the patients virtually. So we got some consultation from the doctors who are working there, and they refer the critical cases for us to get some consults from specialized doctors who are specialized in multiple specialties from around the world, specifically in the USA, Canada, and Europe.
You mentioned that the health system there is exhausted and overwhelmed. I think that's a very, I think in general, the system would have been overwhelmed and exhausted in any normal situation. But when there's, like a general war taking place, but when a genocide is taking place, and it's been well documented that Israel is systematically targeting the healthcare system, and if it's not collapsed already, it's on the verge of collapse. It's made it that much more difficult. And this is really where my next question is. Can you talk to us a little bit about the realities that doctors are facing on the ground there?
Yeah, thank you for asking that. And that's very good question. The medical system over there, it's really overwhelming and exhausting, and it's maybe in very severe shortage of everything. They have shortage of the healthcare workers. The healthcare workers themselves, they are feeling exhausted physically and emotionally. We are and are as healthcare workers just here watching the news, we are feeling overwhelmed, exhausted, and drained. So what about someone who is over there and who is facing the starvation, working under the fire and working under the severe catastrophic that is happening over there? As well, because of the lack of the hygiene and the sanitation and the basic medical supplies and the basic humanitarian needs for the people over there. They are living in the camps, they are living in the tents, they don't have hygienated water, even the food they are getting is not cleaned. So because of that, there is a severe diseases that is spreading, like the very rare skin infection, very rare critical diseases and serious diseases. Our colleagues from Gaza have mentioned that they have a critical disease called Guillain-Barré syndrome, and this disease is very rare to be happened in the normal situation. But now in Gaza, it's really spreading because of the deterioration of the medical system over there, and they don't have the treatment, which is plasmapheresis or IVIG. And this disease, if you couldn't treat it, it will end up to affecting the respiratory system, which will end up to having a death. So can you imagine all of that? As well, the medical system over there, we have some photos from our colleagues. They are treating the patients on the ground. They don't have a bed, or they don't have a bandages, or they don't have the basic medical needs to treat the injuries or the bleeding. Also, the medical system over there has a lack of medication, the basic medication. As you know, when we are having infections, we treat them with antibiotic. Now, the antibiotic is not founded, and there is a huge resistance for the usual antibiotic that we are using. So I think, just from looking to the photos and from looking to the news, you can imagine a very huge image about what is happening over there.
It really is actually. I know you're saying you can imagine. It's hard to fathom what they are going through, to be honest. Um, I know that doctors have been reporting that they've been confiscating things, even like baby formula, when they're trying to enter and trying to bring in baby formula. So, when it comes to more important things like medical supplies, we know that those have been obviously not allowed in. So it's really hard to imagine what the situation they're going through and how they're even dealing with that. And like you said, if people here are exhausted, how are they feeling there dealing with this day in and day out? I wanted to ask you, you did mention about some of the work that you're doing here with doctors that are dealing with the situation there and their mental fatigue, their psychological issues. Can you tell us a little bit more about the work you're doing here?
Yeah, thank you. Our colleagues, specifically on the ground, we have multiple teams. We have a team who is working virtually to support them through treating the medical cases that they are referring them. And we have some physicians who are working on the ground in Gaza through our medical points as well. They are working in the hospitals in Gaza. They are physically and mentally exhausted. They are the same as Gazans, but as well they are doing their own job and their own role to help as much as they can. So they are under starvation. We are having some of our colleagues, and you can see his video in our page. You can look at his body, and he's starving. Some of our colleagues are getting some diseases, and they are under a lot of threat because they are targeted as well. As well, regarding the mental health of them, a lot of them are being exhausted, having depression, anxiety, panic attacks. That was one of our reasons to raise awareness of how to deal panic attacks, and we collaborate with multiple mental health coalitions to support them and to treat them.
So my last question for you is, do you feel like these doctors have a message for the world, and how can people help and support your effort?
Yeah, that's very good questions. Actually, our message and their message is always just keep speaking up about what is happening, keep sharing, and keep donating, and keep helping in all the ways that you can. The more we are speak up, the more we are helping, the more we are supporting, the more we are getting into a solution for what is happening. especially for someone who is who is in the ground, when he feels that we are supporting them just in the way that we can, as we know, as Muslims and in all the world, that if you can't change something by your hand, if you couldn't change it by your tongue, if you couldn't change it by your heart. And this is one of the Prophet Muhammad hadith about how to change any alayhi salatu salam, how to change anything happening in this world. So I think the situation now is happening in Gaza. It doesn't need you to be a doctor or Muslim or Palestinian. It just needs you to be a human being who feels and who carries a heart that can't handle what we are seeing over there. So the main message to the world is keep donating. Every $1 is making a difference. A lot of people are starving, and because of this starvation, they are getting a lot of diseases. They are getting skin infection. They are getting their basic medical body homeostasis, which is the normal physiology, is deteriorating because they are not eating very well. They are not drinking they are not drinking hygienated water. They are not living in a basic humanitarian environment. So because of that, our donations, our support, our sharing, and our help in all the ways we can, that will make a huge difference. Even, as you know now, a lot, our social media is the main, is one of our ways to speak up and to raise those awareness. As well, I recommend the people to share the awareness that we have shared in our page. It's in Arabic, so if you know anyone in Gaza, you can share it for them. It's speaking about how to create oral rehydration therapy, oral rehydration solution, how to deal with the basic medical needs. That will be a good addition for that.
Yeah, we could definitely include that in the description of the video. This is part of the effort that we're doing here at Muslim Network TV, where you see a lot of the stories like the one you're talking about, your organization, not being covered. So we want to take charge of that stories and make sure that, the normal stories of the people that are under siege there, they are human beings too. They have their own stories, their own lives, their own dreams, their own wishes. And a lot of times those stories don't get told. So we're trying to do our effort here to do that as well. Doctor, thank you so much for joining us. I really appreciate you shedding some light on what's going on there in the ground.
Thank you for having me, and thank you for being always the backbone to share about what is happening in the world. That's very important. Thank you.
Assalamu alaikum.
Wa alaikum salam.
This is Ahmed Ramadan from Muslim Network TV with an exclusive interview. Please stay tuned for more. Leave your comments in the section below. Assalamu alaikum.